Hi friends, welcome to another episode. Thank you so much for joining me today. So my name is Joyce and I am the face behind this channel. I am a physician associate in the UK and I work in general practice. So in this channel, basically we are just educating each other on different conditions and also talking all things health, motivating each other with advice on exercise, weight loss and stuff like that, and obviously insights on being a physician associate in the UK. So if that's something that you're interested in, please do subscribe, comment, share, like. All right, so if you recall, I talked to you guys on my previous video about that I am doing a series on conditions to do with basically gastro conditions, so conditions to do with your tummy. So last time we spoke about acid reflux, so today we are talking about gallstones. All right, so stick with me. What are gallstones? So basically what they are is it's where the balance between the constituents of bile is compromised. So usually bile is made up of cholesterol, bilirubin, and so when those things are not balanced properly, these hardened gallstones form. All right, in terms of symptoms, what you would have is you can have quite bad tummy pain, which is usually on the right, so right upper quadrant of your tummy, and it's quite severe. You can also have pain in the middle as well, upper tummy on the middle as well. You would find that you could also have nausea and vomiting, and because like I mentioned, bilirubin, if the balance of the bilirubin, cholesterol and things like that is out of range, you would find that you would also have jaundice. So jaundice is when your skin yellows, essentially your skin, or even your eyes as well, you'd notice the yellowing. Sometimes babies are born with jaundice. If you've had babies before, you would know what I mean. And fever as well is another symptom of this, and chills. So it's quite an extreme presentation. So basically with gallstones, this person is really unwell, systemically unwell. Let's talk about risk factors. So what puts you at risk of having gallstones? One thing is, unfortunately, being a woman, so it increases your risk of having gallstones. The other thing is being overweight, or if you have, but then on the other side of this, if you have rapid weight loss, I guess again, if you think about it, those constituents are a little bit not quite what they should be. So if you have rapid weight loss, the constituents, the constitutions of the bilirubin and the cholesterol and things like that would be not quite stable, should we say. And the other thing is having high cholesterol is another risk factor, and having a family history of gallstones as well. In terms of investigation, so if someone comes in general practice with possible gallstones, what are the kind of things that we would do? Do blood tests. Ultrasound scan as well is another way of imaging. Going back to the blood test, the reason why we do the blood test is to check for infection, inflammation, because if there is infection there, and definitely with the gallstones, your infection markers will be high. The other thing is you would also have a specific endoscopy. So endoscopy is when you have a camera down to actually see what's going on in there. So that would be more of a secondary care investigation. So really in primary care, ultrasound scan, blood tests, and then we would refer you to secondary care, because ultimately the treatment would be surgery. So the thing is, with gallstones, you would find that symptoms, you have flare-ups. So it's not all the time that you would be symptomatic. So with some people, they have gallstones and they are fine with them. You know, they might have aches and pains here, but they're fine. So in that case, we would employ watch and wait in terms of the management for that. But if someone presents acutely and they are severely unwell systemically, we would then refer you to the surgical team. With gallstones, the pain is quite extreme. So it's usually like, most people describe it as a 9 out of 10, 10 out of 10, you know, severity. So in terms of monitoring, you definitely would need to be followed up by the surgical team. The only thing is, I need to tell you guys, is there is a chance of recurrence. So you can have that recurring again. You can have gallstones forming again in the future, unfortunately. So definitely lifestyle does help. So like I said, it's linked to bilirubin and cholesterol. So balancing that out would definitely help, or go a long way into prevention of gallstones in the future. So if you have had gallstones in the past, or you know someone who has had gallstones, please share with us and share your experience with us, so that we can all learn from what you've gone through and your experiences. I do hope this has been helpful, guys. If it has, then you know what to do. You need to share, like, and subscribe, so that this, you know, this movement can reach others who need the information, essentially. So I will talk to you guys another time, and I would be interested also to know, guys, if you have any specific topics that you're interested in, any health related topics that you would like to know, or if there are any specific like physician associate videos that you are interested in, do let me know, and then I can get those done for you. Take care. I'll see you on another one.